So when you try the crown in on the patient, it becomes contaminated with the patient's saliva. So one of the best ways to decontaminate the internal surface of the restoration is to use a sandblaster, or in this case, we're using a... So one of the important steps when it comes to bonding BruxZir is to decontaminate the restoration after you've tried it in. So when you try the crown in on the patient, it becomes contaminated with the patient's saliva. So those salivary phosphates could certainly inhibit bonding. Whether you put the correct zirconia primer, bonding agents, that saliva is blocking those sites. So one of the best ways to decontaminate the internal surface of the restoration is to use a sandblaster, or in this case, we're using a Chairside MicroEtcher. Within this vial, we have 50 micron aluminum oxide, and this will help not only remove those salivary phosphates so that we have a clean surface to bond to, it will also roughen the internal surface so that we have extra surface area for the zirconia primer and then subsequent resin cement to bond to. So after we've tried it in, we've confirmed the fit. It has become contaminated. Now we're using this Danville Chairside MicroEtcher, and I'm applying this to the entire internal surface. This is a BruxZir NOW Crown, which was milled chairside, which offers the same strength and durability of a lab-made BruxZir. But since it's milled chairside, the mill creates such a smooth and polished surface on the intaglio. It's actually a little easier to identify what areas you sandblasted because they become a nice, dull, matte finish. After the restoration has been air abraded, we'll just use an air water syringe. I'll rinse this off, but this just removes some of the dust or debris that may have been left over from that aluminum oxide that we just applied to the restoration. So we rinse that out, dry the restoration really well, and now we'll follow this up with a zirconia primer. A zirconia ceramic primer is a ceramic primer that contains MDP.